Hi, my name's Kiara Furrer, and I'm a sports medicine 3 student at South Tahoe High School. And for my project number 4, I did surgical rehab for an ankle arthroplasty. This photo shows the ankle anatomy. The ankle is made up of the tibia, the fibula, and the surrounding foot bones, including the caneus, the talus, and all the tarsals. What is an ankle arthroplasty? Ankle arthroplasty is a total ankle joint replacement with the use of an artificial implant. This procedure is used to replace a damaged joint in order to eliminate the pain and swelling. The surgeon will make an incision and remove the damaged parts of the tibia and talus. The surgeon will then attach artificial metal joints to the remaining bone surfaces with a piece of plastic between for smooth gliding. Why would you need to get an ankle arthroplasty? The main cause for ankle arthroplasty is severe arthritis. Symptoms include severe pain, inflammation, and stiffness. Different types of arthritis include osteoarthritis, which is wear and tear arthritis, which is most common in older people. Then we have rheumatoid arthritis, which is a system-wide autoimmune disease that affects the joints, and arthritis, which can happen due to a past injury to the joint. Here we have x-rays of an ankle fusion versus a total ankle arthroplasty. In an ankle fusion, you see that they just put screws to stabilize the ankle, while in the total ankle arthroplasty, you can see the pieces of metal and the plastic put into the ankle to replace the joint. Next, I will go through the 4 rehab phases in the ankle arthroplasty rehabilitation process. For phase 1 of rehabilitation, it is usually from surgery to 6 weeks after surgery. Some precautions include wearing a short leg splint for about 2 weeks, a cam boot, which stands for controlled ankle motion, for about 1 month. You should be non-weight bearing and complete frequent elevation while also watching for infection in the area. Rehab goals in phase 1 include daily life activities with safe crutch use, control the swelling and pain, ankle range of motion of 2 weeks, which we are focusing on plantar and dorsiflexion, maintain the knee and hip range of motion, increase hip, knee, and core strength. Some exercises we do in phase 1 include frequent elevation, ankle active range of motion for dorsiflexion and plantar flexion, 4-way leg raises lying down, knee active range of motion, and edema massage to help with swelling. Here I have a video of the 4-way lying down leg raises. As you can see, the first one is sitting down and you just lift your leg straight up. This can be done with the help of a physical therapist. Next, we have lying down and pulling it with the other leg crossed on top. Third, we have lying on your stomach and just raising it straight up. And finally, you have lying on your side and raising it straight up without having the other leg crossed over. After phase 1, usually about 6 weeks after surgery, we move into phase 2 of rehabilitation. Some precautions we use in phase 2 are to progress weight bearing as tolerated in the boot. Rehab goals of phase 2 include reducing swelling, increasing ankle range of motion, increase the mobility of the scar, maintain hip-knee range of motion, strength, and flexibility, and to get the active range of motion of the ankle between 5 degrees for dorsiflexion and 20 degrees for plantar flexion. Some exercises we use in phase 2 include gait training and weight shifts, active range of motion and passive range of motion, calf stretching, 4-way ankle isometrics, and then the seated tilt biomechanical ankle platform system board, and also swimming. And here in this picture shows a picture of the BAPS board. Phase 3 of rehabilitation is usually after phase 2 is completed and about 10 weeks after surgery. Some precautions for phase 3 include avoiding exercises that create movement compensations and slowly progressing away from the boot. Also progressing weight bearing as tolerated with use of the ankle stabilizing orthosis as needed, which is a brace. Some rehab goals of phase 3 are weight bearing as tolerated in the shoe, normalize your gait, ankle proprioception, and improving ankle strength. Some exercises in phase 3 include gait training, scar massage, calf stretching, 4-weight ankle strengthening with the resistance band, balance and proprioception exercises, functional movements such as squats and steps, and once again, swimming. Phase 4 of rehabilitation is usually after 14 weeks of surgery after phase 3 is completed. Precautions in phase 4 include avoiding forceful impact activity to the ankle. Rehab goals of phase 4 are to get a normal gait pattern, a single leg stance with good control for more than 10 seconds, to have the ankle range of motion between 10 degrees dorsiflexion to 35 degrees plantar flexion, and be able to complete a single leg heel raise. Some exercises in phase 4 are balance and proprioception on unstable surfaces, such as the BAPS board, higher level functional movements such as floor transfers, lunges, and walking on hillsides, and once again, swimming. Some general rehab extras are driving. If the operation is on the right foot, the patient may return to driving when they can safely demonstrate an emergency stop to someone else, such as a professional in the physical therapy business. Another one is returning to work. 4 months is standard for after ankle arthroplasty. However, the type of work and the impact amount on the ankle should be taken into consideration before returning to work. Thanks for watching, and I hope you enjoyed.